The endoscopic removal of colorectal polyps is the most frequently employed and the most fruitful therapeutic application of colonoscopy. Over the years, different techniques of colonoscopic polypectomy have been investigated and used. However, all techniques have the following strategy in common. First, the endoscope is advanced as quickly as possible to the cecum. Second, while the instrument is being withdrawn, a thorough examination of the colonic wall is performed. As a consequence, all removal of polyps is done when the instrument is pulled back. Most endoscopists agree that larger polyps should be removed only during withdrawal. Smaller polyps, for example less than 1 centimeter in size, are also usually resected during withdrawal of the instrument. Unfortunately, some of these smaller polyps can no longer be located at withdrawal of the colonoscope and remain in the colon. As a consequence, it has been recommended that small polyps detected during insertion of the instrument should be removed instantly in order to ensure a high resection rate of detected polyps. Unfortunately, data clarifying this issue are currently lacking. In some studies, it has been reported that the colonoscopy miss rate can be as high as 27% for adenomas smaller than 5 mm. However, it is still unclear how many colorectal polyps might be detected during insertion and missed at withdrawal. Similarly, it is also unknown whether the endoscopist spends additional time during withdrawal to find a polyp detected during insertion. In this study, Wildi et al. Aimed to assess the miss rate of colorectal polyps for polypectomy performed during withdrawal of the colonoscope compared with polypectomy during both insertion and withdrawal, as well as to compare the time required to carry out both types of procedures. Insertion is defined as pushing the colonoscope forward to the cecum, and withdrawal is defined as pulling back the colonoscope. They hypothesized that removal of polyps during withdrawal only would be associated with a considerable polyp miss rate compared with the strategy where polyps are removed at both insertion and withdrawal of the colonoscope. They further hypothesized that polyp removal during insertion and withdrawal is less time-consuming compared with removal at withdrawal only. Their findings are reported in the November issue of Endoscopy in the article entitled Colorectal polypectomy during insertion and withdrawal, or only during withdrawal, a randomized controlled trial. Removal of colorectal polyps is routinely performed during withdrawal of the endoscope. However, polyps detected during insertion of the colonoscope may be missed at withdrawal. We aimed to evaluate whether polypectomy during both insertion and withdrawal increases polyp detection and removal rates compared with polypectomy at withdrawal only, and to assess the duration of both approaches. Patients were included into the study when the first polyp was detected and randomized into two groups. In Group A, polyps less than or equal to 10 millimeters in diameter were removed during insertion and withdrawal of the colonoscope, while in Group B, These polyps were removed at withdrawal only. Main outcome measures were duration of colonoscopy, number of polyps detected during insertion but not recovered during withdrawal, technical ease, patient discomfort and complications. 150 patients were randomized to group A and 151 to group B. Mean plus minus standard deviation duration of colonoscopy did not differ between the groups. 30.8 plus minus 15.6 minutes group A versus 28 plus minus 13.8 minutes group B, with a p-value of 0.176. In group A, 387 polyps, mean 2.58 per colonoscopy, were detected and removed, compared with 389 polyps detected, mean 2.58 per colonoscopy in group B, of which 376 were removed. 13 polyps were missed, mean size 3.2, standard deviation 1.3 millimeters, 7.3% of patients. Patient tolerance was similar in the two groups. The authors conclude, removal of polyps less than or equal to 10 millimeters in size during withdrawal only is associated with considerable polyp miss rate. They therefore recommend that these polyps are removed during both insertion and withdrawal.